state of care.
Hello and good day to our listeners. Welcome to the State of Care podcast, where we talk with industry practitioners and professionals within the healthcare, adult and social care industries to discuss what's important to them when delivering care. I'm LEONARD TANNOR. I'm the Strategic Operations Manager for a learning disability supported living home.
Hello all, and I'm ASEFA. I'm a Supported Living Accommodation Director and a great enthusiast in bridging gaps between our industry stakeholders' knowledge through their personal experiences, as well as a great endorser in tech systems and processes to deliver better personalised outcomes and clear pathways for our community.
Today we're joined with a very special guest, MUKEWA, who is the Director of Link Community Care Services, and we'll be discussing a number of key areas within social care.
So Innocent, please tell listeners a bit about yourself and your professional experience.
Hi. Firstly, I would just like to say thank you very much for having me on the podcast. It's an absolute pleasure. I've been in social care for quite some time. I've been running a home care service or community-based service for the last 14 years. It's a very challenging industry. I enjoy it thoroughly. And I'm looking forward to giving you some of my views.
Amazing.
Fantastic, Innocent. Thanks again for your time. So just to start off, pretty much, in regards to the current gaps in provision, Innocent, of the workforce development are being identified as of late. What are they?
I would say when it comes to workforce development, the issue that providers are having, or the areas that we struggle with, is that we usually don't have the resources. We just don't have the trainers. We just don't have the expertise to deliver the types of training that's required by the service user group in particular. So it is a very, very contentious area when it comes to training, because we just simply don't have the money, the funds, and I think we need support for that from the government and from the local authorities. I also find that when training is delivered by providers, there isn't much standardization. So the training that you'd get from provider A will vary significantly from the training that you get from provider B. And there does need to be some sort of standardization so that the training is at the same level across the sector, across the country, and it doesn't become a postcode lottery in that if you're living in London, you're getting, let's say you've got learning disabilities and you're living in London, you're getting a slightly different service to someone who's living further up north. I also think when it comes to the workforce, there's a common known problem of lack of a workforce altogether within the industry. And for providers, I think there needs to be a lot of joint working with the government, with the CCGs, with the commissioners, in finding ways to improve that. And it can be things as simple as starting to think about how the industry is going to look, how the workforce is going to look in 10 years' time, where are the staff going to be coming from. At the moment, a lot of the old school social care workers have either left the industry or they've retired. So we need to start thinking about how we're going to galvanize a young workforce to come into the industry. There's currently a gap because a lot of the young people just don't see clear career progression paths in the industry.
Yeah, that makes sense. I mean, it's in effect, the rejuvenation of the younger workforce is very much needed to keep the industry going over the next 10 years. And I think it'll be a very, very important thing going forward, something that needs to be looked at in some detail. But I appreciate your thoughts on that. Yeah, definitely.
I should have a question for you as well. What's your thoughts, and would you agree that there's too many people with learning disabilities being admitted into hospital when admissions could really be avoided?
Yeah, I think it's definitely an issue. There are far too many people within this particular sector that are ending up in hospital when they do not need to be. Exactly. And one of the problems that's leading or causing this, I think, is there isn't much clear understanding of the transforming care agenda, which, as you know, is one of the key government themes in addressing this issue of admissions. And a lot of providers just don't know where they fit in to that whole agenda because it's very broad. Fabulous piece of work. That's so we're starting to see the results sort of filtering in now. But a lot of providers don't actually know where they fit in, and as a result, they're not doing much. And I think sometimes providers tend to look at the transforming care agenda as a massive beast that can't be conquered. And I think we need to start thinking small initially. We need to start understanding where we fit in, and then we need to start taking small steps, which may start with things as simple as making your staff more aware of the things they need to do on a day-to-day basis in order to contribute to people not ending up in hospital. That can be simple things like being more aware of the wider health issues that a particular individual has. If that's maybe they don't eat enough and staff need to be focusing on that, if that's what prevents them ending up in hospital, that is exactly what staff should be focusing on. So providers should be looking at giving their staff more training and improving awareness around things that lead to people being in hospital. I think sometimes providers aren't able to do that. I think some of the barriers are that we don't tend to know all the wider healthcare concerns associated with someone. So as a result, we should be getting more involved in the care treatment reviews so that we meet with other healthcare professionals that are involved in that person's care, and we start to have a wider understanding of the areas that we could possibly intervene and make a difference.
I definitely agree.
Yeah, definitely.
Quite a few good points, isn't it, when you say so, Leonard?
No, I would actually. Funny enough, that leads us on to our next question. I mean, regarding providers.
Just before we move on there, one thing I did want to add to that, Innocent, as well, just come to mind. I definitely agree with what you said, Innocent. I believe something as simple as a more holistic and therapeutic approach alongside personalised care can make a huge impact on the service user's well-being and perhaps even reduce the need of medications, let alone hospital admissions. So I think you brought up quite a good few points. Yeah.
No, definitely. And I think just as well, just when looking at that, and providers as a whole, when measuring their successes in order to realise a transforming care program, I mean, Innocent, from your experience, how can providers show the progress that they're actually making to commissioners who ultimately will be placing service users in the care of providers?
Thanks for bringing that up, Leonard. It's something I've spent a lot of time working on myself in terms of how do we actually show that we are making a difference. And I think it needs to start from providers understanding how success is measured in the first place. And also whether that's going to be quantitative or whether it's going to be qualitative. I think there needs to be very clear understanding. And then we need to be standardizing the way we capture data, the way we measure data, and the way we present that data to the commissioners. We've had an outcome framework before, but I think we need something that is more tailored or suited to actually reflect directly what's going on in the transforming care agenda. So maybe in a similar way to training standardization, there should be some sort of standardization of the way we measure outcomes, which outcomes we're measuring, and how we present them. It could be that we all use an outcome star. It could be that we all use a traffic light system. But as long as we're looking at the same things, then the data starts to make a bit of sense. Having providers doing and reflecting what they're doing in different ways, I think gives the market plurality in doing that. It doesn't necessarily mean that it's going to be easier to actually see whether we're making a difference. I think it's very important to standardize and to understand what we're measuring in the first place.
Fantastic. Fantastic. You mentioned, I mean, technology can play a major role in that process as well. I can imagine in regards to making sure that the systems there is a system, possibly an online system, where that standardization can be met. And I think that's something that should be looked into more if it hasn't already.
Absolutely. I think you get new systems that are being used at the moment where staff on the ground can actually record the outcomes on tablets, on their phones, and they can do that in real time and actually give service users and their families real data on what outcomes they're meeting and how they're meeting them.
Fantastic.
So yes, we just had a lovely Q&A discussion, and we appreciate your time. Until next time, I'd just like to say thank you very much to Innocent for coming around and spending time with us.
Yeah.
And Innocent, would you like to let the listeners know where they can find you?
Yeah, we're on linkcare.org.uk. We have a few locations that we deliver services to. We're currently in 4 local authorities, so you should be able to find all our details online on our website.
Fantastic, brilliant. Also, I'd like to thank Leonard Tanner as well. Thank you, Leonard.
Sure. No problem.
And this is ASEFA, and until next time, goodbye.
Goodbye.